of Health and Poverty at Brack University.
Yeah,
I got that at the school. Yeah.
Still have to raise money.
Still have to raise, but a lot less. And it's given her space to write this wonderful book. And so we're going to be hearing from Sabina. Her book is on poverty, gender, and health in the slums of Bangladesh, children of crows. And it's an ethnographic exploration. Sabina is an anthropologist of the daily struggles, particularly of women and their families in informal areas in Dhaka, with a real focus on health, but also how marginalized people sort of manage in those circumstances, which is really, again, central to the sort of concerns of Arise. So poverty, injustice, health, marginalization. So we're going to start with Sabina giving us a bit of an overview of her book, and she's also going to get a reading, which is very exciting. And we'll then have two discussants who I'll introduce, but Suhala Nazneen from IDS, also Lenore Manderson is joining us from either Joburg or Sydney, I'm not sure which, and then from South Africa, wonderful. And then there'll be a chance for all of you to ask questions, discuss, and finally Sally will close the event. Great, so I'm going to hand over to Sabina. We're very excited to hear, and you can actually use a lapel mic, which is that
easy?
right?
Yeah.
Wonderful.
Sorry. Hello. Yeah. So I'm not going to do I'm going to do summaries because I know I have 20 minutes or something. But first of all, thank you. Thank you to Haley, Liz, Leah, Sally and Kate for bringing this together. Thank you for making the time to come. It's good to see some old friends, colleagues again, and meet some new ones. I think it's always a great opportunity, and thank you for making the time. So I think part of this was like, it took me ages. It was always in my head that I wanted to write about these young women I'd met and spent about 15 months with. It kind of changed the trajectory of sort of even my thinking around health. Even though I studied medical anthropology, a lot of my work has been informed by critical health disparities. And I mainly worked in rural areas. So I moved to Bangladesh when I was in my 20s. I was just not planning to. I was just going to backpack and find myself and have fun. And my uncle was like, why don't you go and work at this place called Brack? And I thought, okay, why not? You know, you think you know everything and you feel you're invincible. My dad was freaking out meantime. So I joined Brack, went to some villages, and it literally changed the trajectory of my life because I ended up never leaving. I ended up living and working in Bangladesh, and I joined the university about 20 years ago. But the PhD was a turning point because the data from this book draws on my PhD from 20 years ago. And then literally 20 years later, because I started tracking young women and men, so it's about 84 sort of longitudinal case studies over time from 2 different periods. It's a luxury you don't often get in the world of funding and development. Arise allowed me that sort of flexibility, and a PhD always allows you that flexibility, particularly if your discipline is sort of anthropology and social science. So I started this journey 20 years ago, and I remember 20 years later sitting at COVID, the school shut down, we were given an announcement. I'd just been to Delhi in a meeting, and I didn't believe the COVID stuff. I was like, yes, but come on. The world is not going to shut down, and we got all the news. But I think what affected me was I started getting phone calls because the people I was ended up doing ethnographies with were young people I'd known since 2006. So I'd known them for a long time. And I'd done on and off sort of work with them. And it just took me back to my PhD fieldwork. And I just started thinking, there's so much going on that we talk about with progress. And Bangladesh is a success story. So I'm not taking away from that. But I think there's also this hidden kind of stories of those who remain chronically deprived or lead very precarious lives. So 20 years later, when I was having these phone conversations, it was very similar because the first lot, so I mean, I started thinking about, there are these untold stories and I keep talking about it, but I don't write. and I should write these stories, whatever form it comes out, but I should do it. So it really, that was the journey that inspired me, but also kind of a very practical, realistic, sort of depressing look at how, class, poverty, privilege, politics, the global, the local, the national, all interconnect, including my own role, where I was not affected by COVID per se, just worried about deaths. And I had people I'd gotten to know, young women and men, who were worried about starving, who were worried about jobs, who were worried about being picked up and arrested, about young people who I'd met 20 years ago who got evicted, their slum got demolished. They were born in that place. And you have to remember, for many of these individuals who live on, if we say the margins or chronically marginalized, is that it's the networks of support. Usually the neighbors, the grocery store keeper, the person who knows them in the Shumiti committee who gives them the loans. It's the landlady you've known for 5 years who gives you a waiver on you can't pay your rent this month, you can pay it in 3 months. So when things are disruptive or whenever there's a crisis, and that's why I want to unpack like, what do we mean by crisis? What do we mean by even gender? A very nuanced look at what gender means when you have structural factors and drivers that are purely driven by capitalism and by class inequalities, by a lack of accountability investment, both nationally and globally, that really wreak havoc on communities that live perpetually in sort of precariousness. So that's to sort of give you a sense of what I was trying to put together. And it's literally ethnographies. I draw on different kinds of theories, but it's not overly theorized because the theories are there. But I wonder about practice, because we can keep theorizing, and it's something that I looked at 20 years ago. It's a different set of theories I've drawn on since then, because you have theories that react with each other and you have new theories. But the reality is the practice and interventions, and despite the successes, some just remain in this underbelly. So the journey was lengthy, and the Children of Crows was originally quite different from what I'd envisioned. I want to acknowledge my dad, who's no longer around, but I think he's around somewhere, because he was really pushing me to do the writing, and I kept procrastinating, and I didn't think I could. Because we end up in a public health school doing a lot of journal articles, but you don't kind of think about, okay, how do I bring this together? So, Dad, wherever you are, I know you made the fellowship happen and you're making these launches happen, so thank you. I also thought it would be interesting to look at 2 different time frameworks to really understand how, in some ways, certain structures of precariousness and crisis after crisis really destabilize people, no matter what year they are in. And they combine to produce intergenerational poverty and persistent sort of. So why urban slums? Well, urban dilemma is that urbanization is seen as the great modernization. But if anyone has spent time in any urban big cities, there is always this periphery or sometimes in your face. And that's happening even here. But in Bangladesh, in India, if you go to Kenya, it's really sort of this sort of growing urban dilemma of growing inequalities. And it's very much in Bangladesh as well. And as I want to say that for them, really, it's because all you have, particularly if you live in slums, is your labor and whatever space you can rent. You can't rear, cows or animals. You can't have any land to work on. It's literally what you have and who you know to help you manage your lives. So just to share like 2 or 3 case studies or stories that I've, spent time with these individuals. And I want to also acknowledge my research colleagues, assistants who helped me along the way. And before I get to the stories, and Asif, because I forgot to thank him, for the slideshow behind me, he put it all together, because these are pictures from women I'd talked to, but also some of the pictures he's taken. But anyways, so I'll tell you about Mansoura. I met Mansoura 7 months prior to the slum being demolished in 2002. And Mansoura was a young woman. She'd married and the place was demolished. She wasn't as affected initially because she was a tenant. And she had this love-hate relationship with her landlady. And she said, oh, well, now I'd like to see what happens to all these snooty landlords, because they're going to be out of a place. And I'm a tenant. And yes, I have to find a place, but that's been the story of my life, right? She had a marriage where she eloped and married this guy. She had a young boy. Meanwhile, this place that had been evicted within a few weeks had boundaries set up, and it was barricaded, And you know that in Bangladesh or Dhaka, because land is so expensive and there's a lot of investors from politics to business people, there's a whole kind of network of people who control land, okay? Slum takes over a couple of months later, 5 or 6 months after. Mansoura and her family had relocated 3 or 4 times to find a space. I don't go into details in the stories, but I get a phone call, frantic phone call. She's pregnant. She's had a clandestine abortion. She doesn't have the numbers of the health providers because the slum that had the clinic had been long gone. The health providers that she'd known well, she didn't have their numbers. And this is 20 years ago, people. Now everyone has pretty much a mobile phone, but people didn't always have a mobile phone. And she was desperate and she was frantic and she was bleeding. And I was in touch with people because I was following families. And so then I went rushing to the new site that she went to. And she was in a lot of trouble because the World Bank at that point, of course, well-intentioned, had removed the diesel carbon 3G motorcycle vehicles to make it carbon friendly, environmentally friendly. But the point is the World Bank doesn't understand the micro level negotiations required to pay off a whole series of brokers to get the new license. So her husband, along with thousands of others, had no jobs. And her husband was one of them who had no job. He did work irregularly. He was difficult, but this was one of the stable incomes. There was struggling with severe cash shortages. This landlady wasn't willing to waive any rent, didn't know them, new face, socially disrupted. And we were worried about her, but she felt like they didn't have a choice. She had to have a clandestine abortion because she couldn't afford the money, and she also owed her mother money, because they're all in difficult situations. So these relationships are always tested. They come together, but there's also tested in trying times. You meet other people in these books. There's Roshanara, whose mother was a landlady, and she lived in this slum. She was born there. So when when the slum was demolished, she said, this is my home. This is the only home I have. And her mother said to me, who I call Chachi, because, that's auntie, that, we are like kakir bacha. We're like children of crows. We just have to go from here to there to there. They keep kicking us out. So Roshana went through some difficult times in the new space. They had to split up the family because they had to pay rent. Her husband had got into heroin addiction. She was thinking of going back into garments work because for her, staying at home and looking after baby and working from home was very important, but she could no longer afford that. And there's many other different stories. There's Saida, the health worker who made ends meet because health workers are paid very little. Usually they are the bridge to the community, but she was selling saris on the side and a broker for informal abortions for women. La, 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 it goes on. It's and there are stories of also joy and celebrations, but I found that the stories of dealing with disadvantages, precariousness, and struggles occurred much more. And also because that was my focus. So it doesn't, I just want to say I picked one kind of voice or truth to kind of show their state of existence for most of the time, but they do have, I was invited to celebrations and birthdays and events at these places, and, extremely hospitable, and they took care of me. Anyways, 2 decades later, March 2020, everything shut down, as we know. The world shut down. In Bangladesh, there was a day, it was declared a holiday. So people were confused. We knew, but the young women who were calling me up saying, the government is saying there's a holiday, but I've lost my job. So while maids were losing their job, drivers were losing their jobs, people in the informal economy were losing their jobs, and everything was shut down. So I couldn't leave my house, but I was online getting paid and working. Whereas, about 3 million of urban, those who are working and run the informal economy, actually had no work. So I meet Meena, who calls me and says, what am I going to do? I've been fired from my job and they're saying it's a holiday. How long will this go on? The holiday extended for a couple of months, well into June. But these were people who literally worked every day and earned an income to survive. So there's Meena, who then walked miles during the lockdown, and they didn't fine her, surprisingly, the police or the law enforcement, because she said, I have a little baby. She'd carry a baby. So usually they'd leave you alone if you have a baby. And she'd say, and she was literally walking place to place. Gulshan is the richer suburbs, there's particular certain areas, and she'd knock to various places saying, is anyone looking for work? They understood something was going on, but for them, it was more starvation and having a job. You see this journey of Meena. She'd come back from Jordan, a failed trip, lost her job. No one was hiring. doing odd jobs. By June in Bangladesh, there was partial opening up because there was so much backlash about, you know, the economics and the ruin of like garment workers and others, and people were just on giving it back to the government. And the business lobby, much more than the health lobby, which is clinicians, were much more sort of powerful lobby for opening it up. In the end, we find Mina in a situation where her husband has TB, which is still stigmatized. He doesn't work as often, and she's offered sex work. She shares with me with a lot of shame that she doesn't want to take it on, and she's not going to take it on. But it's kind of open-ended. We don't know because the options are so few. You meet others like Shuli, who basically had a love marriage. It was a second marriage. A lot of them marry young, and it's not about forced marriages. There's lack of options. You have, you know, you have sex, you're expected to get married. You also want to have children. You want emotional bonds. You have young children, you women living adult lives, literally adult lives. They're having miscarriages, abortions, pregnancies, working from 15 onwards, where we're all in high school or going to college. And so the aspirational world still remains, but it's informed by a very different micro world. And Shuli used to sell towels when all the COVID happened, and post-COVID, she was arrested by the police because we're doing a city corporation drive to clear up the streets to beautify Dhaka city. You'll see it in every place where there's Olympics or any place that happens where they're hosting big events. They will clear out hawkers who have, by our labor laws, there are no laws for those who are in the informal economy. So someone like Shuli, her husband was killed in a road accident. And I was informed of that in 2022, just when he got some stable job. Road accident injuries happen quite often. You can pay off the police, and if you're rich, you're actually never held accountable. So when I met her recently when I was leaving, you know, because she's still selling on the street. She begs or sells towels. And she's, you know, she was another young man who's interested in her. She was alone. She had a little baby. Her mother-in-law was helping. And she said to me, Appa, don't worry, I'm not getting married again. You know, I still miss Shumon, because they were very much in love, and they moved a couple of times. So because they moved around so many times, they had no support. But anyways, the stories go on and on and on, and there's many more stories. There's Fatima, who was selling towels when she was 8 months pregnant because her husband lost his job. There's that's Fatima. And there's also like Shuli, who then has she grew up selling on the street, her children sell on the street, and she continues to sell on the streets. There's many, many different stories. But my point was that, what does it tell us about public health and development? What can we fix as public health? I mean, I am a social scientist. I'm a medical anthropologist that came into public health because a lot of my work was in health. But increasingly, I live and work in Bangladesh, have since the 90s. I'm worried about the development and public health silos that we operate in, both theoretically, but in terms of our framing, but also in terms of funding. And we talk about multi-sectoral approaches, we talk about community engagement, but I think at the end of the day, we collectively are, in an academic speak, it makes sense, but in the real world is messy and chaotic for those who live on the margins. And secondly, public health continues to have a biomedical model with an agenda model that's very driven by a North American feminist framework. While that's important to bring to the forefront women's issues, I do think men then become invisibilized, particularly very, very vulnerable poor men who are chronically also on the edge with their wives. And the issue of family and understanding the cultural, social embeddedness of family versus this individual agency, which is overstated. I would like to say, you know, we tend to romanticize resistance and agency, where actually all they're doing is surviving. So I challenge some of these discussions through the ethnographies. I also challenge, you know, tools and methodologies, this obsession with RCTs and surveys, which are useful. Methodologies are always useful, but it's not very inclusive of social science and other disciplines, from political scientists to historians, to anthropologists, to philosophers, because we're dealing with human beings. And if we want to dehumanize and understand health and development and how precarity and everyday lives are such sort of struggles, then we need to have a very comprehensive understanding and rich sort of contextualized understanding of what goes on in terms of what we actually talk about in terms of policy and practice, because that still remains siloed and often articulated, but never really implemented. I also talk about what do we mean by social determinants of health or structural drivers of health is 2024, COVID, climate change. We keep adding layers and layers of different crises. But actually these people that I was working with since 2006, and I'm not in touch with the ones in urban spaces. Unlike rural spaces, very hard to stay connected from 2001 and now. There's so much instability, but all we do is add layers and layers. But endemic poverty and endemic exclusion, socially, economically, materially, are huge drivers of bad health. And if we continue in this way, all we're doing is adding to their maladies, and really the accountability of global, national, and even us as researchers, academics, and practitioners is called into question. I think I'm going to end here because there was a lot of sort of, sorry, just one final point about, I would just say that one thing I learned from all of this, the individual stories are also very unique. Yes, there's some similar themes, but like we have a tendency, even myself, to homogenize for poverty and understandings, but it's really quite interesting how lives kind of unfolded. And it was always like when I was talking to them, I couldn't even predict what would happen, the deaths, the fatalities, the sudden kind of eviction overnight, which I didn't face when I was working in rural spaces. And it reminds me of, I think stories are very important to humanize the depth of lived experiences and lived realities, and contexts very much matter. And we need to pay attention to our methods and tools. Yeah, thank you.
Sabina, thank you so much. I can hear they sort of really that whole, from your experience, really showing how those ethnographic accounts of lived experience really illustrate, as you said, that sort of trying to navigate precarity and the sort of limits to agency. So not some sort of superficial understanding of resilience or coping, but really showing these different networks of support, but also the limitations of those. So those were really powerful and vivid accounts. Thank you. But also for articulating this contribution to broader public health questions. So also that sort of methodological point about ethnographic accounts as being such an important contributor. And then finally, some really interesting conceptual pointers, I think, the sort of challenging that Western feminist framing, offering alternative accounts, but also sort of challenging that idea of resilience, I think. So thank you. Thank you for doing that all in such a summarized way. So in fact, Arise has sites in India and Bangladesh, but also in African settings in Sierra Leone and Kenya. And we now actually are being joined from another African setting in South Africa, where actually many of these insights, there are parallels. So we're going to welcome Professor Lenore Manderson from the University of the Witwatersrand in Johannesburg, and long time colleague and collaborator of Sabina's, and she's very kindly agreed to join us and just offer some points of discussion on Children of Crows. Thank you very much.
Thank you so much. It's lovely to be here. I want to reflect on the provocations of Children of Crows and to draw out the complexity of the book a little bit more than Sabina has done already. I'm going to refer to it throughout by its subtitle, Children of Crows, because this is how I knew the book as it took form and because of the power of the metaphor. It's not Sabina's metaphor. At the very beginning of the book, the householders of Fulbari, the slum in which Sabina first worked, are forced out. Chachi, who Sabina's already introduced, not the poorest of the residents because she was a landlady, she'd been crying, her eyes were puffy. She says to Sabina, and I quote, "We're children of crows with no respite, forced to fly from one place to another, looking for a place to live." What did she mean? Crows feed incubating female crows, and they feed the nestlings and fledglings. They defend their territory and the nest, They stand guard over other family members while they forage. They mourn the dead. In this, crows are unusually sociable for birds. They're family-oriented. They watch out for each other. They make sure others in the flock don't starve. In Children of Crows, while Sabina focuses on 6 women, 3 from 2002 to 3 from 2020 to 22, the book is very much also about the women's families and their relationships to them, their partners, their parents, their children. So why did Chachi choose crows to speak of their demise? Crows scavenge and steal. They feast on carrion, dung, small animals and insects, nestlings of other birds. In their search for food out of cities, they strip crops. Perhaps Chachi recalls the dismay of farmers seeking to protect their crops and their livelihoods, fiercely chasing the crows away. As Chachi says, they're forced to fly from one place to another. So the people of Fulbari must find somewhere else to live. But the search for security in where they live and where they work is a constant one. They, Dhaka residents, may need to move again at any unpredictable time, perhaps because some developer has bought the land, or the state has new plans for it, or because, ashamed of accruing debt and their inability to repay, the residents must find simply somewhere new to start afresh. Crows flock together. Chachi is a landlady, but that does not imply she is wealthy. She shares with her 2 youngest daughters 3 adjacent rooms, a narrow residence, a small entrance, a small space out the back to bathe, and a latrine. She has a small area for cooking. The main room has a single bed and a cabinet, a broken chair. She has more than most of the women with whom Sabina worked: a latrine, cooking utensils, a cabinet for clothes. Others share facilities. Their rooms are dingier and dustier. But with relocation, Chachi also must find new ways to support and hold together her family. There is no guarantee that this will be easy. Crows are intelligent. They are renowned for their problem-solving and communication skills. They're opportunistic and creative. They exploit new food sources and adopt new feeding strategies in order to survive. So too, Sabina's friends are constantly having to find new ways to survive. They're proudly entrepreneurial. Shuli, for example, until COVID interrupted this, was doing street business as a hawker. She would wait at the traffic lights for cars to stop, plead at windows to drivers to buy stickers or plastic bags, or most recently, towels. During the early months of COVID, until around July 2020, she lost this opportunity and then resumed work, resisting lewd comments, rebuke, and rudeness as she did so. Fitting with the metaphor, the women are resilient. Chachi and her daughter, Rabea, work as maids. So too, Mina and her mother, Mita, worked as maids, walking to houses to save to pay from paying for rickshaws. Mina lost her employment with COVID. Poor people now were seen as vectors of disease, as well as scavengers, sex workers, and thieves. She persisted. She asked guards, doormen, and drivers if they knew of work. She was humiliated, insulted, and abused, and was deeply ashamed that this was so. She was ashamed too that her mother begged once she could no longer work as a maid. She was ashamed that her husband didn't work. Like other women, she hated the work involved not of selling on the streets, for example, but she hated the begging for credit, taking out loans with impossible interest rates, struggling to juggle managing and protecting her children, doing so from a position of extreme poverty without the education, connections, and opportunities to make things otherwise. Sudden illness, workplace injury, a traffic accident, a fire or a flood, a pandemic, all these things made their lives that much harder. The women in Dhaka are no exception. The majority in the world build their lives around economic, political, and environmental precarity, persistent personal and structural violence, and constant threats to their health, safety, and well-being. Dhaka is illustrative, not unique. Children of Crows provides an account of life in the city's slums across 2 decades, during a period oriented, for some of us, by the Millennium Development Goals, and then, in face of their shortcomings and a continuing agenda for justice, the Sustainable Development Goals. The foreword to the 2015 report of the MDG begins with the claim that, and I quote, global mobilization behind these goals produced the most successful anti-poverty movement in history to free people from, and I quote, the abject and dehumanizing conditions of extreme poverty and to improve their lives and their future prospects. There is a caveat, however. Nearly 1 billion people then lived in extreme poverty. Of these is Bangladesh. We struggle to find fundamental change. Some people have changed the kind of work they do and where and how they live. Even people with modest incomes by 2020 were living in a world of ATM machines, cell phones, and social media. But Sabina's friends and confidants live in a parallel world. In this, the ironies and false promises of development and modernization are sharp. The ethnography of Children of Crows is characterized by crisis, the eviction of tenants in 2002, the pandemic and its disruptions in 2020. In each case, Sabina's family and friends and their friends and neighbours needed to reinvent their lives, always in the context of dragging poverty, violence, and neglect. There's an ugly mismatch between these realities and the global health and development agendas as recognised by development's champions, as well as those whose lives are shaped by these. Again, to refer to the MDG report, maternal mortality rates had fallen and female literacy rates had improved in South Asia, including Bangladesh, markedly. That is, fewer women were dying from pregnancy-related conditions, such as unsafe abortion, such as that suffered by Mansoura, and more young women attended school for some time. But very young women in Dhaka still work in garment factories and on the streets and beg. In South and East Asia, especially between 1991 and 2015, employment opportunities diminished, they did not improve, and greater numbers of people faced unemployment, underemployment, and informal work opportunities. Young women especially were disproportionately affected by this trend. Women like Mansoura and Shuli, Roshanara and Meena, with little or no education, married at Menaki, with children soon after, divorced or widowed by their late teens, carrying the responsibility of caring for their families in their very early 20s. The magic in this book and Sabina's writing is that these women get under the skin of readers. Each chapter brings us back to them, to their strategies for survival and their struggles for work and food, for example, and to gang fights, brushes with the police, arrests, challenges in accessing healthcare, but also their disappointments and loves, sadness and joy. They're familiar, friends almost. They draw us deeply into their own and others' lives. The painful brutality in women's lives in urban Bangladesh, as elsewhere in the world, is the obscene contrast to the lives of those everywhere for whom high incomes and accumulated wealth fence off risks and buffer them against emergencies like COVID. It's a lesson for the limits of approaches to development and what this means in cities and countries of searing inequality and poverty. The storytelling of Children of Crows is riveting. But the book does more. By engaging readers, Sabina asks us all, as she just has now, that we critically engage with the forces that produce these disparities: post-colonialism, globalization and capitalism, and consequent greed, ruthlessness, rapacity, and moral vacuity. It's a book that is powerfully provocative for those of us concerned with development and its limits and its failings. It's a book that will sing to anthropologists, but it is also a powerful and moving intervention for students and scholars in global and public health, politics and the law, development economics, and development sociology. Thank you.
Thank you so much, Professor Manderson. That was a wonderful contextualization of the book within these broader debates in development and health, and also just a testimony again to the sort of vivid storytelling. So thank you so much for joining us and contributing. So I'm now going to call on my colleague Sohela Nazneen, who's a senior fellow in the governance cluster, has also obviously long-standing connection to Bangladesh, also to BRAC University in governance, and has very kindly read the book and is going to offer her reflections this time, I guess, a little bit from outside of health, but as we've just heard from Lenore Manderson, the book speaks to these wider debates. Thank you so much, Sohela, and I'm going to give you the microphone.
Thanks, Hillary. I'm calling you Hillary constantly because Hillary's on my brain, because it's Bangladesh, because it's health, because of the long connection. Sorry, Haley, my apologies, but then Sabina has also done that. All the Bangladeshis are doing that, partly because that has been one of the key connections for Bangladesh in terms of looking at health research. But having said that, it was a privilege to read the book before it came out. So thank you, Sabina, for sharing it. I am going to embarrass you, but that's towards the end. And I do have some questions for you. But having said that, Haley, thank you for asking me to speak at this event. My comments are going to be coming from a perspective as Bangladeshi myself, and also someone who just finished a program that looked at social and political impact of COVID. That's the CLEAR program that funded different types of research. So in Bangladesh, with Bangladeshi organizations, including JPJ, the thing there was to go beyond looking at the pandemic as a health crisis or an economic crisis, right? So to unpack that. So this book, actually, the issues that you talk about in the book speaks to some of the issues that are emerging from that program, which is why I thought, okay, that would be interesting. And also to touch on areas around, since we are at the Institute of Development Studies and we talk about what can be done or what could be done better or how do we think differently. So a lot of it is around thinking through policies and programs. So I'm going to touch a little bit on that also. So I'm reflecting on parts of the book and things that I took from the book that spoke to me. Obviously, there's a lot in the book, and it is rich, not just in ethnographic detail, but in the way it brings different intersections together to understand lives at the margins, lives that are lived on precarity, thinking about crisis differently, because every day is a crisis. It's not just when a big crisis happens. So there are, of course, life-changing events, but there are everyday struggles are, in a way, you are in such a precarious situation that you're constantly struggling. There's no relief or respite. That doesn't necessarily mean that there isn't joy or celebrations and all of that, but it's just struggle never stops, right? So having said that, Sabina already spoke about it, and so did Lenore, that she's looking at two different time periods in the lives of the stories that she's following, and she focuses on 6 characters, right, and their families. But obviously, these families are facing a particular type of crisis in terms of, for the first set, it's the eviction. So losing a place where you live is a big crisis. And for the second set, it's the global pandemic that's unfolding and affecting everyone around you and around the world, right? So what got me thinking, because I work on gender and women's rights, is to think through what has changed. And Sabina reflects on this. What has changed for the women if you're looking at 2 different time periods in sort of the way Bangladesh's development has unfolded. And we know that in the story way Bangladesh's development is talked about, women's empowerment is a big part of that story. Lenore touched on this in the way of women's well-being. So if you look at maternal mortality or rates in terms of girls' education in school or women's participation in the economy, we celebrate all of that. But that celebration comes with a caveat, right? So if you look at, because when we talk about development, we talk about leaving no one behind. And if we really think about development is actually about those who are at the extreme margins, how are they and how they exercise agency, then looking at these sets of lives and thinking through, well, what actually did change for Monsura, who you're looking at in 2002, and if you're comparing it to Shioli, who's in 2020, right? Some things, there's a shift. For example, if you look at the networks that women who are in 2020 have, or their presence in public, very precarious presence, but they're selling towels, all of them are engaged in some form of economic work, which is not necessarily what it is for those who you're looking at in 2002. In terms of the setting and the households that they're in, a lot more extended family structure for 2002, and then the 2020 women have set up nuclear households. All those, they are connected to their families in a way. But apart from these kinds of aspects, which are more individualized, if you think about the larger structural picture, and the precarity that they're facing, both in terms of precarity around livelihood, precarity around the systems that they can depend on, precarity on the kind of support that they can draw from the state, all of that, not much has changed for people. So then the question is, what kind of narrative are we talking about when we talk about development and success? And Bangladesh is talked about as a success story in development. So it's not to undermine things that have changed, but it's also drawing attention to what doesn't shift and why doesn't it shift, right? So the stories draw attention to that. And within that, then thinking through what does crisis do? And in a sense, what is very interesting, and Sabina, you touched on that, is crisis, because of the different intersections, both class, but also the location that you're living in, the networks that you have, and your gender, has a particular type of impact. That impact is gendered. And the way you then try to get out of it, the coping strategies are also gendered, because your gender identity plays out in that. So the networks that the women would have, or how they would navigate, whether that's the healthcare provider or the issues around where do you get services for sexual health or reproductive health, the struggles you face is quite different from what the men are coping with and what they need to do and their expectations of their role and the risks that they would take. And it's important to take that into account as you think about interventions, or if you think about policies, what does it mean? So not just when you're studying crisis and impact of crisis, just having kind of big categories, that doesn't give you that micro level picture. It's important to think through those intersections. As someone who works on governance, obviously informality and informal structures are very important. In informal settlements, obviously that comes out very, very strongly. So it's not just about who owns the land and land ownership, but also you have drug gangs, you have thugs, you have particular political structures. Who's the big brother in these slums? How do you navigate those? But also sort of then, where do you get loans? Where do you go for support when you need medical help? The local pharmacy owner, all of these formal and informal actors play a role, and how then your relationship is negotiated in terms of what you can claim and what you get access to. The role of intermediaries obviously becomes very, very important to unpack. And that is something that we also saw in the CLEAR program. Anu was looking at Raven, Sabina was talking, because we were like, oh, that matches what we did for Chronicles of Hard Time, which was about ethnographic panel data with regular visits to households and collecting data through qualitative methods. And it's a collection of stories. And in those stories, intermediaries come out very, very strongly. So when we kind of in policy talk about, oh, the state needs to do this, or the state has to do that, or the state policy has to be this way, it's also about how are those policies going to be implemented. It's also about when NGOs design interventions, like how would that be implemented and what happens there. What is very interesting and what struck me is the way you're thinking about health. A lot of the time in crisis, it is about health problems as a crisis. So health problem triggers vulnerability in specific ways, and when we look at the lives at the margin. But it's also about thinking through, and you were talking about wider environment. So it's about pollution, it's about the food that they eat, it's about, like whether you can sort of get the kind of treatment that you need when the health problem is smaller. It's beyond, and a lot of the time we focus on the physical and we don't look at the mental, right? And how you are mentally affects how you are physically. So when you talk about Chinta Rog, anxiety, and what anxiety triggers and what each crisis triggers in the lives of the ones you're tracking, all the stories, a lot of the time, we forget that aspect. It almost seems like anxiety is a luxury for people who are better off, but anxiety is present in the lives of people who are more so for people who are the margins. And in the way we do public health policy, or in the way we think about health, or in the way we have thought and studied the pandemic, a lot of the time mental health didn't necessarily always feature, because it was about not letting the disease spread and stopping the infection, and how do we vaccinate people. I know that for Bangladesh, ICDDRB has looked at it, but it's this kind of important to think about holistically and connecting that in terms of how we think around health and how we think around crisis is very, very important. The other two things that I really would like to touch on is the idea of resilience. Of course, we talk about resilience a lot. We talk about agency, and agency is important, and it's important not to take agency away from when we look at people and think people are completely helpless. But having said that, it's about also how agency is being expressed and what are the limits to that agency. And I know Bangladesh is celebrated for its resilience, both national resilience and resilience of the people. We talk a lot about that, but also the pandemic has shown us that it's a distressed form of resilience. You're resilient because there's no other choice. So how much do we want to celebrate that. And your stories show that. And it's important to keep that in mind because we have a narrative that we have constructed around the pandemic and how that has affected Bangladesh and what has it meant. And the official official narrative of the pandemic is we are over it, right? We have managed it. But how far have we managed it? And how far does this resilience come at a cost? And what are those aspects of those costs? And I know like the BRAC and PPRC study has talked about distress resilience quite a lot. So it's important to conceptually take these discussions forward. The last bit is, of course, in terms of bearing account and witness. Sort of bearing witness to what has happened, right? A lot of the time that we talked about in terms of having rigorous data sets for policy development, evidence to convince the state actors, evidence to convince the NGOs who are doing programming and all of that. And within that, then as much as we need rigorous evidence and we need particular methods to produce those evidence, sometimes the stories of the lives get lost, and those stories are important. Think about the history of World War II here, and think about what is there in Sussex Library in terms of history of and sort of stories that were submitted by common people in terms of how war affected them. It's important to have documentation of that, and this book has those stories, not just of the pandemic, but also of the evictions that those of us who lived in Dhaka, we lived through that period. We know what happened to the informal settlements in terms of evictions. So it's important to capture those stories. So this book obviously contains those, which is an important historical account as we will look back at some point to have that documented. Having said that, obviously, then that means in terms of policy, what do we do? A few things you draw attention to. One is, of course, in terms of looking at urban poverty and how that is addressed. What we found is, of course, there's inadequate attention paid to the urban poor, whether that comes to social protection, when it comes to education for poorer groups of children, when it comes to also in terms of then thinking through what, Sabina, you were raising about access to sexual and reproductive health. Of course, there are fantastic clinics, but then the women didn't want to go because the clinic is within that locality. What does it mean in terms of honor and shame and all of that? And you have informal providers, and what does that mean parallelly? So it's not just establishing those clinics and accessibility and all of that. It's thinking through all of these dimensions in the way when we think about delivery of policy and how we address that. And the last bit is, why does the title have poverty and not precarity? Because it is about precarious lives. And a very tiny question, was it kaker bacha or kawacha? Because that's what, yeah.
Sorry, I'm butting in while you're.
No, that was a question to you to answer that.
It wasn't about gender and health.
Uh-huh.
Indexing reasons, Routledge has a process that they have recognizable keywords.
Uh-huh.
And there's a back and forth getting advice from Sally. And I had injustices and health, and because it's really not about health, it's more about structural violence. And I was, so that's, but thank you for that summary of what I was trying to do in the book. Does that answer your question?
Yes. So the only thing I have left to say is thank you for letting me read this book.
Thank you.
No, and that's a great way to start. So Hella, thank you. That was sort of characteristically thoughtful, wonderful. Anu's alarm going off. But yes, I really appreciated actually pulling out the more effective dimensions of kind of responding to these different temporalities of crisis. And then, of course, taking us right to the kind of governance questions, which are also central to arise, actually. How does one sort of, what are the governance ecosystems in these places, and what does that mean for accountability? So thank you. That was really wonderful. and a very good question to start with. So I'm actually going to give the microphone back to Sabina. So you were asking a question about the word for crows. We do. You've covered, you've sorted out the crows.
Creates precariousness, right? If you have resources at any point, you have some level of power of negotiation. So when you actually have no money and you're really at the bottom of the heap in terms of have no networks, then you really are in a precarious position. But I think I wanted, when they proposed that with Children of Crows, I felt it was a better fit because I feel that there is that underbelly of chronically marginalized. And of course, there's been successes and changes and mobility and mobile phones, but I wanted to understand why some of this persists. And my bigger questions were around the dehumanizing approach of public health and development, the siloed approaches of we have categories and boundaries and boxes, and we operate in these boxes, but these are people's lives that unfold. And the same thing about gender, we need a much more sort of a critical interrogation of how that operates in spaces of precariousness, because we also have a very formulaic approach to understanding gender. Not that women are not far more vulnerable in particular ways, but we've kind of invisibilized young men who are also on the margin, who live on the margins, and their families. And we always see them in opposition, but I worked with many families and spent time with many families who work together to try and have good lives, improve, they have aspirations and dreams for their children. And some of them some of those stories get forgotten in our gender empowerment. And I also wanted to make the argument about tools and methodologies, because we still borrow from a very funded, skewed approach about what's important, what is evidence. So what counts as evidence, and who decides what counts as evidence? Who speaks for whom, and what evidence is shared to formulate certain policies so we speak certain truths? But actually, are we holding ourselves accountable to the kinds of evidence we're sharing, and what forms, and what does that, as Leonard put it, what are the limits of that? And do we recognize and critically self-reflect our roles in this and other actors? So that was really kind of my attempt to try and do this. Anyways, yeah.
Thanks, Sabina, for writing this important book. I haven't read it. I'm looking forward to reading it. But, oh, it's on. Okay. Okay. But I think it's, what you're doing, from what I've heard and the, what you've read, what you've talked about, and the others who've commented on it, it brings a lot of really important issues to light, as they need to be. But I think for me, even I've not read it, but I'm just thinking that for me, the key question then in your book is really about the issue about, so vulnerabilities change, but they remain. For me, that's the key issue, really. So why and how do we approach and think about that kind of issue? And it is really a question of, and here I'm thinking about sort of the layering and growth of perhaps things like intuitive knowledge, something about the making of the self in this context. How is it that that there are, in some ways, what I see over these decades is also sort of disjunctions in ways of knowing. So, for instance, the women you're talking about, the families, the kin networks, have particular sort of both bodily and other ways of knowing about what's happening, living through crisis, how to cope, what are the strategies. And this is so different and disconnected from other ways of knowing that we see, that come to us in the development kind of format. And so the point is bridging those ways of knowing. And therefore, I think we need more of that, because it's not an easy solution. The fact that vulnerabilities remain, even though they change in their shape and form. So for me, it's just a comment, really, but I think that's kind of really important. So thank you.
captured it. I mean, I think that was very helpful. Thank you. Is there anyone?
Yeah, no, questions. So, maybe you could use the
So thanks so much. I love the title of your book, The Children of Crows, and particularly in the context of taking a historical look here at development over the decades and the notion of trickle-down theory, of course, which is implicit in the neoliberal framework we've readopted or sort of adopted in the last 40 years. And, you know, picking crumbs off the ground and presenting a picture of how, you know, how does the murder of crows, as a flocking crows, survive in a shifting context of urban development and so on. And the big success story idea of Bangladesh, which we don't want to take away from, but we might want to interrogate what does that mean and for whom. And I very much agree with Suhela's, I think, implicit notion that we shouldn't romanticize his resilience, you know, romanticize resilience in the last few decades as well. And that in itself is a very neoliberal kind of feel-good way of doing development. And I'm wondering, you mentioned about the role of capitalism here. And what we've been seeing over the last few decades globally is this concentration of wealth, which keeps on going, which takes me to poverty versus precarity in your title. I think the story of poverty, relative poverty, is really important in this, and of course precarity is wrapped up in this. So I'd love to hear more about your thoughts about, you know, this is a parallel universe in this success story of development in a way, and to what extent does global capital require this underbelly of unregulated informality in relation to deregulated markets and all the rest? You know, is this not crucial for capitalism to move forward and expropriate? And so, are we seeing a deepening inequalities and deepening divides, or can we? Is there some faith we can put in this trickle-down theories and let the crows grow up to become, I don't know what, seagulls or eagles? Sorry, that's enough. So your thoughts, your deeper thoughts about, or further thoughts?
No, I was just thinking during COVID, what happened was a lot of the garment industries in the West pulled out after giving orders, and Bangladesh was left with 3.1 billion in debt. What does that mean to the workers? What does it mean to the small factory owners? What does it mean when your debts are not covered because you have no accountability and no pressure to do so? What does it mean when you have systems even nationally within a country where you have a profit-making businesses to run, whether it's shops, whether it's, you know, the local three-wheeler industries, where there's a profit-making in terms of license and competing against each other, selling towels, where are the towels brought from? At every level, there's competition. The point is the vulnerabilities and risks often trickle down to those who have the least power to fight back. I mean, a weird analogy, sorry, every time I walk in, and maybe that's just me, I'll go to, and increasingly over the years, because I travel a lot, I'll see more and more checkouts without anyone working in the grocery stores and shops. I always worry. I always think, who's lost their job? Because machines are taking over. But I just wonder, there is this group that keep getting increasingly marginalized, and you see it operating in so many different ways, from the food inflation, you know, with prices going up, a market economy that doesn't have subsidies, or the subsidies are in the form of relief in particular periods. But when you live in a state of chronic one challenge to another, or crisis after crisis, I want to unpack what that means, as Maya was talking about. And so I had earlier said, but the whole notion of vulnerabilities remain, or they unfold in different ways. But yeah, I don't know. So I go through some of these experiences of how there's connections between, suddenly there's a policy, there's an event, there's a global, and then you've got the whole global health politics, the entire notion of public health, which is biomedicalized, that feeds into a pharma industry, that feeds into a very hospital-oriented sort of treatment only. you've got a huge pharma industry in our own country, but it's also perpetuated, if you saw with COVID and vaccine. You can go on in the interconnectedness, but yes, I talk about some of it as it comes in and out of their lives and the costs to health and well-being. Yeah.
Yeah.
Sorry.
It's okay, we've got some online questions here. The first one says, did you see any indications of the practice of caste in your research? How did those outside of the slums, the urban elite, interact with those within the slum, if at all?
Wasn't caste. I mean, because you spend time, there are minorities. Usually it's a hierarchy by social and economic status and your power relations within that settlement. So you could be a minority and have a very long established residency there just because you own the house or you have enough networks with your landlord. You also have different spaces that are siloed by para, by locality, poorer, well-off, but slums also are settlement slums. I prefer to call them slums because I feel settlement sanitizes what people live through, but it's so diverse and varies. But my focus, and it was not deliberate, but whoever I ended up speaking to were Muslim young women because we're predominantly a Muslim country. But if you go outside certain areas, of course you'd meet others. Yeah. So caste, I think class and privilege, micro, macro operates. From north to if you say global north and global south, there is politics, privilege, and different kinds of lack of accountability. If you talk about within Bangladesh, there's privilege, politics, class, and then within the slums. So it's always operating, and we're part of it. Yeah.
So the next question is, thank you. Many of the stories you've shared show the persistence of poverty as an intergenerational force. Did you observe ritualistic practices of honor, shame, purity, and pollution? Were they also intergenerational?
So first of all, everyone wants to live in dignity. That was my point. And we forget about human dignity. And I felt public health dehumanizes people into numbers, or as you refer to, is like we become a collection of numbers or stories, but these actual real lives unfolding. And I didn't focus on pollution but you have certain kinds of rituals that exist over time around labor, child labor. You have certain kinds of beliefs around certain illnesses like jaundice. I didn't go into detailed health rituals. I looked at really how everyday life and the many factors that come together to make your life and also create bad health. But is there shame? Yes, there's shame. There was fears of if the landlady found out that they begged, they would be shame. They were ashamed. They were scared if the police showed up and someone said your father is dealing marijuana. There was shame and fear about being stigmatized. We didn't talk enough about stigma of status and the need to be accepted and to need to look presentable to be accepted within your own communities. And I don't think we talk enough about that. And I tried to talk about the whole notion of dignity. Even if you're begging, you go far away from the space you're living in, your mother may beg, but then don't tell anyone you're begging because when you go home back to your slum, you have neighbors, you have friends, you have networks, right? But yes, certain kinds of rituals do continue in birthing practices. Depends in menstrual, it's changed a lot, but that wasn't my focus. Yeah.
There's one more question online, and then we can move back to the room and get more questions. Wonderful to hear Sabina talking about this work, and I'm sorry I can't be there in person. This is from Janet Boddy.
Oh.
I particularly welcomed your point about the embedded nature of a family and men's experience within that. Could you say a bit more about how, as researchers, we can get better at capturing men's perspectives in family studies and when thinking about gender?
So I think when I was young, much younger, when I was doing my field work, I was struck by how many of the young men would pick up their daughters or sons and say, you want to talk to Mansoura, you want to talk, I'll take care of her. They take them out for candy. I saw young men helping their wives with the cooking. I saw young men helping wives who were sick. I found young men nursing or looking after their mothers. And I thought, why aren't these stories there? Why do we have one story? All men are homogenized, they're all demonized, or they're invisible. Particularly in the development discourse and public health, men don't even exist, or if they do, they are brought in as a solution. to help women, right? So when I continued my fieldwork, I just found that we also forgotten social, cultural, we talk about context, but we still work in categories, right? So if we really want to embed our understanding and learning in context, first of all, it varies. I'm not saying they aren't sort of difficult men or women who are vulnerable who've really struggled and suffered, but there are also men who are struggling and suffering around, I want to take family planning methods. There is no intervention for me. This was ages ago. I remember my master's with Norplant because women had so many problems, but there were no field workers working with men. We barely promoted condom use. So I feel like we need a more nuanced reflection, and methodologies in development and public health tend to favor surveys, RCTs, quick, we talk about parachute researchers. Development health research tends to be parachute oriented. And it's a challenge. And I will say that till I drop dead, because I live and work in Bangladesh, and I have been. I haven't gone anywhere else. I choose to live and work in Bangladesh. And there's so much richness to understanding how people's lives unfold. And we've othered the poor rather than trying to, how do our lives unfold? And it's complicated and it's complex. If we allowed for the complexities of understanding families and men and women without taking away from the fact that we do need to prioritize women just because they have vulnerabilities for particular, they're stigmatized, they're particular vulnerabilities because of who they are and their age. But let's not forget the role of family and culture in society. It's not, I think I haven't said in the book, this notion of being secular means you can't mention family or you have to always talk about an individual is problematic if you actually live and work in countries where it's about the family. It is about your cultural, social milieu. And you add to that with the challenges and the problems and the solutions. And I do think we need to push back on some of this and also write the stories to get people to think a little bit more thoughtfully about recommendations. We're so quick on the policies and recommendations. After a while, it's a little bit like a formula. And I'm sorry, I'm part of that formula problem, but I just wanted to raise that. Yeah. Thank you, Janet. Yeah.
Hi, thanks so much for such a nice little teaser presentation, because I too haven't read the book, but I'm now enthused for reading it.
Thank you.
I had a question that, the link between health and poverty, and we know that poverty means you can't access good health very often, and being in poor health means you drop into poverty. So it's like a vicious cycle. And I wanted to get some of your thoughts on how the point that Sohela raised, the stress and anxiety, mental health, feeds into this circle, or enables people to come out of it, if at all. Because there is research now that shows that people who are under a lot of stress and duress and anxious tend to make poor decisions, however you define them. And I'm not sort of making a value judgment of the decisions that these women made, but just if there was some reflection on, could they have done differently? Do they regret doing some things because they were in a certain position at a certain time? From your stories, can you shed a little bit of light on this particular question? And the comment I wanted to make is I totally agree with you on this surveys and things being like a very one-sided look at the whole question of health, public health. And, I think one of the things that's struck me is that, in the judicial system, we look at testimonies as very strong evidence. Yeah. And these are stories of individuals. And why are we rejecting them in development studies? So, turning this on its head is a very important thing that you're doing.
Thank you. So I was just going to say that your question was with women, young women, I remember during my PhD, a young woman couldn't decide, Mansoura, whether she was going to spend the last bit of money she had to buy an egg for her little baby and cook it with rice. She managed to get some rice. Or did she go to the health clinic because she wasn't feeling well? I can't remember the story, or whether her baby was feeling well and she couldn't decide what to do. I was quite struck because I thought, if I had to live this life, I can have the luxury of hypothesizing. I don't even know if I could make some of those choices. They're calculating a bit of money. Okay, I'm going to pay the rent, 1/3. I'm going to go get that meal. I'm going to also make sure I pay the person I owe debt to. And then I'm going to save a little bit more because next week I need this. So they're constantly thinking and strategizing, and they're so smart in how they manage their lives. I would completely fall apart. I mean, I have 2 things going on in a meeting and I'm like, oh my God, vent, vent, vent. But these people, these individuals, young women, young men, are constantly trying to figure out, first they have to keep up relationships. They have loves and lives and strong networks. They have emotional attachments. At the same time, they also have hostility. And it's like if you owe someone a loan, ideas, and you don't pay them, and there's hostility and tension. It's the same thing. So they manage and negotiate all the time while they're trying to pay off for meals, food, health services. And one of the problems of public health is we kind of start with health systems and stop with health systems and talk about some health clinic and facilities. I guess for me, one of the challenges was like, why don't we just look at how people live, where they are born, where they die, and how they live is because of the choices we have imposed on them. So there is no such thing as choice. They live within constraints, and there's a collective role. I don't want to go all activist, but like it's more about from academics to practitioners to even the larger questions that we have to ask ourselves is how do we create these conditions of deprivations that continue and continue? And how do we, as you said, bring back testimonies for public health and development? Why is it convenient to have people reduced to numbers? It's a reductionist approach. And then you also invisibilize certain groups. And not taking away from Bangladesh has made huge successes and advances. I myself have seen the changes, but everywhere in the world, there's this growing or existence of these marginalized populations that I see there's more of. Every time I go to the States, every time I visit these different, and we need to have these conversations if we work in public health and development. Yeah. Thank you. I hope that covered.
That's wonderful. I'm aware that Sabina, we're very lucky to have her because she's actually rushing off to a meeting in Morocco, no, in Morocco, right? So she actually has a taxi booked and I want to get her some food before she does that. But thank you so much. And I'm going to now ask Sally to close, but thank you also to the audience. Thank you to Sabina for reading, but also to very helpful and thoughtful discussion. Wonderful.
Thanks so much. So Sabina, congratulations. And let's give her a round. Yeah. Thank you. I think with my Arise hat on, I just want to say we're really proud of this fantastic book, this fantastic output. We've got a beautiful website for Arise, so shameless plug. Kate set it up, it's wonderful. We've got lots of outputs, ariseconsortium.org. This is our first book and it is out. Here it is. It should definitely be in the IDS and Sussex Library. And here it really is a fantastic power of critical, embedded, empathetic ethnography. And the testimonies, the voices of women through time that shows us this urban paradox. And Lenore said, you know, we get to know these women, they get under your skin, they're friends almost. And when I finished reading it, I immediately got in touch with Sabina and wanted to know what's happened next, right? Because it's the power of the stories and how we learn about these women's lives through time, thinking about suffering, precarity, agency, poverty, and how you situate that beautifully within theories of structural violence, bringing an intersectional lens. And just to tell you super quickly how the book works, right? So chapter 1 lays out the issues. Chapter 2 is beautiful on methods and how those played out, about ethics and dilemmas. Chapter 3, we get to know and get introduced to these women who we get to know so well. And then there's paired chapters. So the earlier data and the later data that unpack stories and challenges around livelihoods, around health, around police and legislation, and takes us, Maya, as you said, you know, vulnerabilities change, yet they remain. And we've just had an Arise executive meeting this morning with all the PIs, and we heard there's been evictions in Kenya, right? There were evictions in Bangladesh last year. These challenges remain, and those paired chapters, Sahela, are played out against that Bangladesh development backdrop, and also the ongoing legacy and challenges of COVID and psychosocial inequities that remain. And then chapter 11 is utterly brilliant and pulls it all together, right? Against the theories, and thinks about what does this mean for urban, for development, for forward thinking. And as Lenore said, situating the findings within development discourse. So I just want to say congratulations again. I think we can say that this book is well and truly launched.
Yes, thank you.
And let's give her another.
Thank you. I wanted to acknowledge not only, thank you for making the time, but to Lenore, because she read through a lot of this, and Richard and Stella, who gave me a home when I was at Harvard to write. And also just some of my colleagues who've supported me along the way. I know we've wrapped up, but I want to answer your question about the psychosocial distress. I wanted to say it's more than psychosocial distress. They're actually it's not even a metaphor anymore. That's how they understand health, which is we don't have food, we don't have housing, we don't have jobs. So they're much more articulate about their ground realities, and they're defining health for us and development for us. We just choose to say, here's a little kind of distress, or here's a category of mental health, but they're actually telling us. But if it was, they're just much more powerless in changing the paradigm in which we understand health and development. Yeah. Sorry, I had to say that because I thought I forgot that point. Yeah. Thank you. Yeah. Thank you so much for sitting through this. And I hope you get a chance to read it. And I'd love to hear your comments. And thank you, Sahela, again, for agreeing to be a discussant. And Haley, thank you. Liz, Leah, and Kate, thank you so much for always being my champion. And Sally, thank you.